My name is Suzanne Wilkin. I'm a Health and Wellbeing Commissioner at Norfolk County Council Public Health. So we're here to deliver NHS Health Check training for our primary care colleagues. So we're having healthcare assistants and practitioners from GP practice have their health check training today. NHS Health Checks are an evidence-based and cost-effective intervention that really help to promote early awareness, assessment and management of the major risk conditions for cardiovascular disease. I really want to encourage primary care to take up this opportunity to attend our NHS Health Check training. It's an invaluable resource to be able to collaborate with colleagues delivering the service and also to boost people's skills and confidence in delivering NHS Health Checks to be able to get more people to have their NHS Health Check in the community.
My name's Michaela Nuttall. I'm a cardiovascular nurse and a trainer for NHS Health Checks. For me, the benefits of attending health check training is really trying to make our NHS Health Checks the very best they can be. And that is by having a fully trained workforce that are competent in the delivery of NHS Health Checks so we can really realise those benefits, meaning improving outcomes for patients. Practitioners will learn on our NHS Health Check training a variety of things. They'll understand why it's important to have the health check programme, really what is part of the health check programme and what is part of the health check, along with not just what questions need to be asked, what measurements and tests that need to be done, but also how to explain the results and the answers to patients that they're seeing. For me personally, what I get out of these days is having those light bulb moments where people come along and they might be asking questions and they don't know why they're asking them or how to explain the answers. And as we go through the day and unpack some of the challenging questions that we might ask, that they start to understand why. And throughout the day, we get these light bulbs, whether it's looking at Q risk or understanding how the physical activity score works. That really, for me, makes a big difference and makes my job really enjoyable.
Very informative. It's definitely going to help me with my patient reviews.
Fantastic. She's a lovely person and she delivers what she has to and she makes it a laugh.
Hi, I'm Victoria Millamont and I'm a healthcare assistant at Holt Medical Practice. I've been a healthcare assistant since 2012. I've been doing NHS Health Checks for about a year and a half now. The NHS Health Check training was brilliant. I found it really informative. I found that I could come back and actually talk to my colleagues about it and share ideas and tips with them. And I feel like it's made me more effective at actually conveying risk factors to patients and giving them advice on how to change their lifestyles to better their health in the future. I would say to any other healthcare professionals who haven't yet attended the training to do it. It will give you much more confidence to feel like you know what you're talking about when you are explaining risk factors and cardiovascular disease to the patient, and it makes you feel like you're really getting that message across properly in a good way that they can then work on.
So people wanting to know more about NHS Health Checks in general and also booking their NHS Health Check can visit our website, which is www.norfolk.gov/healthchecks.